Welcome to the Explainer. Today, we're going to break down syncope management, and we're looking at it specifically through a pharmacist's lens. You know, this is one of those conditions where your counseling can make a huge difference for a patient.
All right, so let's set the scene. A patient walks up to your counter and casually mentions they fainted over the weekend. Now, that's not just a passing comment, right? That's a huge flag, a critical moment for you to step in. What you do next, well, that's vital.
So here's our game plan for today. First, we're going to nail down what our role is. Then, we'll put on our detective hats and hunt for drug culprits. We'll also get really clear on telling the difference between vasovagal and orthostatic syncope. After that, it's all about the practical stuff. Non-drug counseling, the actual medications, and then we'll wrap it all up with some key takeaways you can literally start using tomorrow.
All right, first up, let's really lay the groundwork and talk about why you, as the pharmacist, are so incredibly important when it comes to managing patients who've had a fainting spell.
Okay, so what exactly is syncope? Well, the official definition is pretty important here. It's a transient, meaning temporary, loss of consciousness. It happens because the brain isn't getting enough blood flow for a moment. But here's the key part. The recovery is rapid and spontaneous. That's a huge clue that helps us tell it apart from something like a seizure, where the person might be out of it for a lot longer afterward.
And you might think this is a rare thing, but it's not at all. Get this, more than half of us will faint at some point in our lives. That's a huge number. So what does that mean for you? It means you are absolutely 100% going to have patients coming to you with this exact problem. Your knowledge here is totally indispensable.
Okay, now we get to the part where we pharmacists really shine. I'm talking about the medication review. You are on the front lines here, and honestly, digging into their med list to find a potential drug culprit, that's probably the most impactful thing you can do right off the bat.
Just take a look at this list. It's kind of crazy how many common drugs can be the bad guy here, right? The answer is so often hiding right in the patient's medicine cabinet. Of course, we all think of antihypertensives and diuretics, but what about something like the SGLT2 inhibitors? They're everywhere now for diabetes and heart failure. With their diuretic effect, they can easily push a patient, especially an older patient, into dehydration and cause a faint. It just goes to show that med review you're doing, it's not just checking boxes, it's a critical diagnostic step.
So let's say you've checked for any big red flags, you've done your med review. What's next? Well, most of the time, you're going to find that the issue falls into one of two main buckets. And figuring out which bucket it is, that's the key to giving the right advice.
And this is a great way to see the difference side by side. On one hand, you've got vasovagal syncope. Think about specific triggers, like seeing blood, intense pain, or even just standing for way too long. The patient will often tell you they felt it coming. You know that feeling of nausea, getting hot, looking pale? Then you have orthostatic hypotension. This one is all about the timing. It's that immediate dizziness or fainting spell that happens right when they stand up. So by asking a few simple questions about when and how it happened, you can really start to figure out what you're dealing with.
Okay, so now that we can tell them apart, how does that change our counseling? Well, it all starts with lifestyle. Before we even think about medications, we have to talk about the non-drug stuff. This is the foundation, and it should always be your first line of advice.
First things first, just reassure the patient. For most people, this is a benign condition, and that alone can be a huge relief. Then you can get into the practical advice. Talk about increasing their fluid and salt intake. But of course, you have to make sure they don't have something like heart failure or high blood pressure where that would be a bad idea. And finally, help them become a bit of a detective themselves to figure out and avoid their own personal triggers. Is it getting too hot? Big meals? Standing up too fast? These simple things can make a world of difference.
And this is my favorite part because it's so empowering for the patient. You can actually teach them physical counter-pressure maneuvers. So when they get that warning sign, that, oh, I'm about to faint feeling, they can do something about it. Things like squatting down or crossing their legs and tensing up all their muscles. These simple actions can physically squeeze the blood back up to the brain and stop the faint before it even happens. It gives them a sense of control, which is just huge.
But you know, sometimes those lifestyle changes just aren't quite enough. And that's when we have to turn to medications. So let's dive in and break down the two main drugs you're likely to see prescribed for this.
All right, so here's the 30,000-foot view of our two main players, midodrine and fludrocortisone. They work in totally different ways. One's an alpha agonist, the other's a mineralocorticoid. But they share one really critical side effect you have to counsel on, and that's supine hypertension. Basically, high blood pressure when the patient is lying down.
So, when you're counseling on midodrine, the #1 thing to hammer home is the timing. This drug actively raises blood pressure, which is great when they're upright, but dangerous when they're lying down. So the rule is simple. Do not take it late in the day. The classic advice is no doses after 5 p.m., or at least 4 hours before they plan to go to bed. This is all to avoid that dangerous spike in blood pressure overnight. And, give them a heads up about some of the weirder side effects like scalp tingling or itching, just so they're not surprised if it happens.
Okay, now for fludrocortisone. Here, your counseling script really needs to focus on fluid retention. You have to tell patients to be on the lookout for things like swollen ankles or any sudden weight gain. And it's absolutely crucial to emphasize that this drug is a no-go for anyone with heart failure or uncontrolled hypertension. They also need to know that they'll need to get some blood work done pretty soon after starting, specifically to check their potassium levels and, again, that supine blood pressure.
Whew, okay. We've covered a ton of ground. So let's pull it all together and boil it down to the absolute most important things you need to remember for your patient conversations.
Now this is a big one, and honestly, it's something that can get missed in a busy pharmacy. Driving. The rules about driving after someone faints can be really different depending on where you are. So please make it a standard part of your counseling to tell patients they must check their local guidelines and talk to their doctor to find out when it's safe to get back behind the wheel. It sounds simple, but that one piece of advice could literally save a life.
All right, here it is, your Syncope counseling checklist. Let's run through it. Number 1, always start with a medication review to look for culprits. 2, non-drug strategies come first. Teach those lifestyle changes and counter-pressure maneuvers. 3, if they're on meds, you have to nail the counseling on supine hypotension and potassium monitoring. And number 4, don't let them walk out the door without mentioning driving safety. Got it?
And that brings us to our final thought, a little piece of homework to take back to your practice. It's great to know what to do when a patient brings this up, but what if we could be more proactive? How can you build this into your routine? Maybe it's as simple as adding one more question to your med reviews. By the way, have you had any episodes of dizziness or fainting recently? Just imagine the problems you could catch early by making that a standard part of your workflow.